Hello, welcome back. I wanted to talk about something that's apparently not directly related to my prostate cancer, but it's something that has plagued me for quite a few years now. And it has to do with my prostate. It's prostate enlargement, that benign prostate enlargement that I've mentioned in previous videos. I think my first video. It's something that men are experience as they grow older. And what happens is if the prostate gets big enough that it constricts your urethra to the point that no urine can pass, then your bladder starts filling up with urine as it normally would, except that when the time comes that you have to go to the bathroom, you can't. And then you really have to go to the bathroom. And then you really, really have to go to the bathroom. And then it gets into a dangerous situation where your urine can back up into your kidneys and give you serious problems. This happened Well, this has happened to me several times and has resulted in trips to the emergency room. But I want to mention one particular case that happened to me when I was at the second nursing home that I was sent to. Not the one where I feel I was abused, but the other one. And it started out at about 7 o'clock in the morning. I felt like I had to go to the bathroom, and I couldn't. The apparently my catheter must have been blocked, and no urine could go by. So the catheter needed to be changed. I tried to find a nurse to let her know. I finally found one. She said, "Well, you need to drink more water." And I said, "I don't think that's going to help me. That's going to make things worse." But I drank more water, and yes, it made things worse. And started, mind you, 7 o'clock in the morning. Then I told the nurse, "This is getting much worse." And she said, "Well, I've called the doctor, but I'm waiting to hear back from the doctor. I can't do anything without getting instructions from him." And I thought, "Are you telling me? Are you serious? Are you trying to tell me that you can't do a simple catheter change?" Time went by. Fortunately, back then I could walk very well, so I was pacing back and forth like a lion at the zoo, down the hallway outside my room. And the nurse was still telling me that she was waiting for the doctor. And finally, she heard from the doctor, and she tried to do a catheter change. But guess what? She didn't know how to do it. She was trying. She didn't know how to do it. Now, because I've had problems with prostate enlargement and bladder spasms before, I had a lot of practice with self-catheterization, what they called straight catheter. And I finally, at about maybe 6 o'clock in the evening, after 11 hours of true pain, well, I don't think they call it pain, but it's not pain. It's just imagine not being able to go to the bathroom and having to go really bad. So in the process, she started trying straight catheterization instead of trying to insert a new Foley catheter that's softer. And she wasn't, she couldn't do it. She wasn't finding a way to get to the bladder. She tried it several times, and finally, I pretty literally grabbed the straight catheter from her hand and said, "Here, give me that. I'll do it." And I did it to myself. I immediately found the bladder. The urine started flowing, and I felt a sense of relief like I hadn't felt in a very long time. And apparently by that time I had been sweating for hours because she said, "Yes, I knew that you really needed to do this because you were sweating. And when a patient starts sweating like that badly, I know that he's in pain." And I was thinking, yeah, duh. So after I did that, she was actually able to insert the Foley catheter connected to the bag, and things went well after that. But it is amazing to me that a nursing home doesn't have nurses that are trained in catheterizing people the right way, because that is something that, like I said, happens to especially to men as they grow older. Their prostate gets bigger and they have problems going to the bathroom. And I think that women have problems going to the bathroom too for other reasons. So they should know how to do this, and they didn't. This, like I said, it's a condition that has sent me to the emergency room several times until my urologist finally said, "Okay, what you got to do is flush your catheter." And the reason they said that was because my guardian angels, who had been, who were hospice house nurses, I met them at the hospice house, were very experienced in doing that. And they flushed patients' catheters sometimes 3 times a day, certainly twice a day. So I mentioned it to the urologist, and the urologist said, "Yeah, you can do that. I guess it's like, why couldn't you have thought that on your own and told me and saved me some trips to the emergency room and saved some money to the Veterans Administration, who they were paying for the trips to the VA and to the ER." And I'm about to do a video on the Veterans Administration because I'm going there this afternoon for a routine checkup. But anyway, what you do is you disconnect your catheter from, you have a Foley catheter that connects to a bag. You disconnect the Foley catheter from the bag, and you plug in a syringe with sterile solution, and you flush the catheter. You do that twice a day. And since I've done that, I haven't had any problems anymore, period. And I hope, I hope that I'm not jinxing myself by saying this, but up to now, I haven't had any problems. So please, nursing homes and other places that take care of the elderly. Have personnel that are trained at least in the basics. I beseech you. So that's my story having to do with bladder spasms. If you have any questions or comments, please send them to me. And if this has been helpful to you, please subscribe. It helps me if you subscribe. So I'll see you later.